I'm Dr. Shankar. I'm excited to bring in a new technology to the Brentwood community. This is exciting. Now we have a robot for dental assisted surgeries. And what it basically does is it helps with dental implant patients plan implants, place implants with a robotic assistance that guides us, just like you're driving your car with a GPS and it's raining and it's dark and your car knows where it's going. Imagine the precise technology applied to dental work, where we are placing a dental implant and we exactly know how deep we are going, how close we are to the dental anatomy in the mouth. And even if it's bleeding where we can't visually see it, the computer knows through a link that is connected to the patient. And this is our surgical arm. So basically the way it works is we screen our patients for medical clearance, make sure they don't have any surgical contraindications, and they're good candidates for dental surgery. Once we have their records updated for medical clearance, we do a scan, which is usually a 3D scan of the mouth. That basically gives us a virtual view of where the implants are going to go, what's the bone texture. We use the 3D scanning X-ray machine for that. The images are downloaded to the Yomi computer, and we can go ahead and plan in 3D precisely where the surgery is going to be conducted, the sites, and it scans for bone density, closeness to the sinus, the maxillary nerve, the maxillary and the mandibular nerve. And once the plan is in place, the Yomi computer is linked to the patient through a patient link. The unit is surgically draped, and most of the components we use on the patients are disposable. So sterilization is a top concern. Once that's in place, the computer virtually knows where I'm going to be doing the surgery. The patient's numbed for the site, and we go ahead and do our surgery. We basically use the surgical arm, and according to the plan on the computer, the Yomi guides us to placing the dental implant in the patient precisely, accurately. It's very effective, and very much less pain is involved. There's very less bleeding, so the healing is much faster. We are also able to plan for the final restoration as part of the plan. So if it's going to be a crown or a denture, it kind of tells us the trajectory as to how the appliances are going to connect, which is an added advantage. And one of the newer features of the Yomi is it does the bone leveling for us. So the computer basically tells us it needs a flat platform for the dental implant. So all the threads are in secure bone, and it helps us from the scan remove any infected layer of the bone. So if you're losing tooth because of a periodontal disease, the top portion of the gums may have been infected and it's not ideal. We can plan some form of bone reduction prior to the surgery. So we know that when we place the implants are in solid bone. So let's take a look on a model. For example, if you're taking out a tooth, we have a bony socket here, and once the implants are placed, we go ahead and add a bone graft, cover it with collagen membrane, and we kind of monitor healing. Everyone heals differently. Typically 4 to 6 months of healing time. We take scans, and once it's healed, you'll see nice solid bone, all the threads embedded in bone, and we can go ahead and tighten a crown or a denture to the implant component, and at that point, the implant has gained strength, and it's a feature we call osseointegration, where the implant integrates into normal human bone, and which is a very nice new concept to restore missing teeth. And we basically are restoring the patient's smile and function to what they were used to prior to losing their natural teeth. The technology has been around for a while. I personally have done over 1,000 surgeries using the Yomi unit, and we are in what we call the 1,000 club members. Currently, as of 2024, I have been in the top 10 dental providers for Yomi implant surgeries in the entire country. And so our confidence has been very good, and we're able to screen patients carefully. We screen them for the common issues that we might run into. I have seen the end results, and for the most part, we're able to predict the success rate is very, very high in the 98% to 99% range. But yes, and all our staff have been trained with the surgical components and what to expect and patient care for follow-ups. We have always been forefront in using dental technology towards dentistry in particular. It started with the 3D scanning. It started with the ceramic technology where we're able to mill restorations and from a lab point of view. But as far as for the surgical approach, this, I first, when I read about it, I said, gee, this is using AI technology that patients could benefit. In the beginning, when we started doing implants 12, 15 years back, we were just basically going with the surgical instinct as to where we're going. And there's always a perceived risk of getting close to the nerve, uh, getting close to a blood vessel, or there's bleeding where we really can't see where we're going. And bony texture was more visual, whereas now it's through the technology uses us to tell us. It's like you're digging ground for a construction. You kind of know if you're going to hit a rock or you're going to hit a sand, or and depending on the structure you're going to build, foundation is the key to long-term success. And that has propelled us to use technology to what we are doing. And over the 5-10 years that we have been using the technology, we have seen results. We have seen success. We have seen patient testimonials where they attest to the painless healing periods, the confidence in the technology, and patients have accepted the technology well, and that has encouraged us to move forward with investing in this new technology, which can be pretty costly from a dental standpoint. Patients love it. It's like getting used to any new technology like your iPhone, and with the changing times, changing technology, patients are more apt to listening about it, hearing about it. Our consultation is very thorough, where we take photos and we take scans and we talk about that. I myself have, I'm in teaching. I'm an associate professor at a dental school. So we are into teaching. We educate our patients just like anything new. This is something that patients are already tech savvy, and a lot of them have good enough computer background where they can relate to how the technology is going to help them. And if there's something that's going to be painless, effective, and accurate, I'm sure they understand the value, and we instill the value in them as opposed to the cost factor. And most patients don't mind paying the extra cost involved if they're going to get something that's more durable, that's more predictable, and that's going to be long lasting. So the investment has got a good return. Excited to be the first office to introduce robot technology in dentistry for Brentwood. I'm really excited for the community, and I foresee the excitement that it brings with it. There's a good percentage of people that will benefit from this technology. And just like any new technology, patients are reaching out. They don't have to drive to the cities anymore to get the best in dental care. We are bringing it to them. And we plan to be open 7 days a week. We are offering free consultations for dental implants, so patients can learn about the technology. We are kind of going into social media, the Brentwood Press, to bring the word out and get this new feature to the patients for their benefit, and so they can share this news with their family and friends and coworkers.